are responding to public input, and we now have X's on the stage, so we're practicing a little Leonard Skinner here. Give me 3 steps, I guess. Good morning. As citizens, we all have a right to elect our leaders in a free and open and, of course, a safe environment. It's one of the cornerstones, you might say, of this great nation. And so it stands to reason that rescheduling such an election should only be done in a time of emergency, and by definition, we find ourselves in that situation. Over the last couple days, weeks by now, I've received a lot of concern and input and have met with the Secretary of State on occasion about not just the potential of postponing or rescheduling our primary election, but the feasibility of being able to properly conduct our May primary on May 5th in a manner that complies with both the charge of social distancing and being able to responsibly conduct this election. And while May 5th is, about 7 weeks away, the work that is needed to properly conduct this election and complete it, whether it be programming the machines themselves or sending out ballots, we've got military personnel all over the world, that is all currently underway. And just as I said from this exact position yesterday, my view on that fast approaching primary election is it needed to be pushed back in order to, again, ensure the safety of our county employees, our poll workers, and the voters themselves. But given the uniqueness of an election, I wanted to give the Secretary of State, Connie Lawson, and Chairman Zodi and Chairman Hupfer an opportunity to work out a thoughtful plan for rescheduling this election that would garner a consensus. And I'm pleased to report that consensus has been achieved. There is alignment with this group, and so today I've taken action to reschedule the election that would have been on May 5th to June 2nd. Now, in addition to moving the election to June 2nd, there's some other rules and regulations that will need to be modified to accommodate this election to further protect the health and the safety and ability for people to vote under those circumstances. The Secretary of State, Connie Lawson, our state's chief election officer, is here today, and she'll be able to provide some more in-depth details and discuss some of those modifications that will have to, of course, go before the Election Commission. Secretary?
Thank you, Governor. Welcome, everyone. Before I begin, I just want to thank our Governor and our Lieutenant Governor Crouch for their decisive leadership during this difficult time. It really does make a difference to have a steady hand on the wheel, and I am grateful for all that you are doing. I would also like to thank our state party chairman, Kyle Hupfer and John Zodi, for their work, and I mean hard work, on this issue. As the governor said, we have moved the date of the 2020 primary election from May 5th to June the 2nd. And while many pieces are still in motion, election season is already upon us. I've been in conversation with a number of county clerks, and if the primary remained on May 5th, there would be an urgency tomorrow to send out all military and overseas ballots. And obviously, the clerks are already in the process of recruiting poll workers. With multiple counties suspending normal business, we want to give clerks and election boards time to adjust. So we're making a number of recommendations to the Indiana Election Commission to ensure that every Hoosier has the ability to vote in the primary. We are asking the Commission to do the following: to suspend absentee by mail rules to allow all Hoosiers the option to vote by mail in the upcoming primary election. It's not a requirement, nor does it change policy for the future. It applies to the June 2nd primary only. To allow county clerks to continually mail ballots from now through 12 days before the June 2nd primary to give Hoosiers additional time. To confirm that ballots with a May 5th, 2020 date are valid. To expand eligibility for travel board members to include medical professionals in order to accommodate voters in nursing homes and hospitals. To allow family members the ability to deliver absentee ballots. Currently, only a member of the voter's household may take possession of a voted ballot. The Election Commission will be working on these things, and they will be meeting on Wednesday, March the 25th at 10 a.m. here in the State House in the South Atrium. All of these steps will be in concert to ensure that our election process will continue and that every eligible voter is given the opportunity to vote in the June 2nd primary. It will be a learning process for all of us and will continue to work together in the days and weeks ahead. I am confident that we will conduct a safe, secure, and fair election. Thank you.
Any questions?
One of the things that's popped up has been meeting all the deadlines for the Democrats, state convention. I think, John, that's what you guys also think the national delegates. Is that June 2nd to June 13th going to be enough time to get everything processed, any challenges, provisional ballots, so you guys can kind of cut it close?
I think it will be cutting it close. As I said, we're all learning, but the reason the June 2nd date, we all came to agreement on the June 2nd date because we want to give the parties, both parties, a time to work through their state convention and national convention processes.
What does this extra month buy election workers? What does it buy the state of Indiana people? What difference does an extra month make?
Well, I can't speculate because I don't know what I don't know right now, but the counties have I have been in conversation with many county clerks. I've been in conversation with the leadership of the Clerks Association of Indiana Counties, and they believe that they can conduct an election on June the 2nd.
Will this need to get pushed back again?
Again, I can't speculate, but we've all agreed, depending on the circumstance, we will continue to work together to make sure we have a primary election, and our goal is constant right now for June the 2nd.
Could you talk about specific steps that you're considering to keep poll workers or any election workers safe when you have the...
Sure. We are getting guidance on a daily basis from the CDC on the safe handling of ballots and as well as sanitizing voting equipment. And so we will make sure that we are absolutely up to date on their recommendations on June the 2nd. We do have an agreement. The Indiana Election Commission will have to confirm that when they meet on Wednesday, March the 25th.
Connie, I know, and maybe this may be for Kyle or for John, some of the county sheriff out here have been having trouble getting some of their usual volunteers to work the polls because they are, some a little bit older, those folks are sometimes more susceptible to the coronavirus. Has there been any conversation, any discussion about mitigating some of those populations' concerns, maybe getting more younger people that may be less susceptible to work the polls?
Well, first of all, we know that counties are having trouble recruiting poll workers, and it's one of the reasons we're delaying for 4 weeks. And so there isn't the ability for a county to combine precincts, and we've given the clerks already the laws that pertain to that. But I would say there are many displaced service workers and others in the state of Indiana who I hope that we can recruit and pay them to work our elections.
From either Kyle or John, what is the status of the convention? Are you considering having those done by the central committee?
Our state committee has a meeting set for April.
Sure.
Our state committee has a meeting set for April 1st, and so we have been for at least 2 or 3 weeks considering contingency plans for our convention. Obviously, as Connie said, we're not going to speculate on what the conditions will be as we get to mid-June, but we certainly are planning for alternative methods if they're required. Those are to be determined. We haven't sat down as a committee to start talking about them, but all options would be on the table to figure out how I mean, again, there's only really one central function, which is to allow the delegates to vote. So we would be looking at different ways for them to be able to do that. I have not heard anybody who has been particularly concerned about moving the primary from my end. They've just wanted certainty on if it is moving so that they could make decisions in a proper forum, knowing all the facts on the ground.
Let's see, Brandon's question first, I think, or Abdul. I can't remember who exactly asked what question, but as far as the Democratic Party convention is concerned on June 13th, knowing that the primary would be June 2nd, it does cut it very close. So we knew that going in, and we have been talking about what alternatives there would be. Now, the question, what are those alternatives? I think the first thing we would do is consult state law and see what we're allowed to do. There are things I've talked to the election division about already. A different function that we have at our convention, aside from the Republicans, is that we nominate or we elect our national delegation to the Democratic National Convention. And so I'm in consultation with the DNC, the Democratic National Committee, about what that means. There are certain deadlines that are required by the states to meet in order for the delegations to be in place by the July 13th convention in Milwaukee. So like my counterpart, we are considering all alternatives to the convention, but that's starting with having a convention. We believe it's very important to have the convention, to nominate our candidates, to allow our state delegates to have that voice, and to make sure that we have a national delegation that reflects the state. Is my central committee in support of this? We've had a good discussion this week. So I've got members that have concerns, and I have members that are in support. So we have had very robust discussions this week as we were in consultation with the with our Republican counterparts. So we, like I said, we have folks who are concerned and folks who are in support. So. Well, it's always a concern that a person won't vote. Our job as party chairs is to increase the franchise and make sure people can vote. I think this is a good opportunity to talk about the mail-in voting option. We're talking very much about having, the narrative right now is that people are encouraging others to vote absentee by mail. We're also talking about, and we've spoken this week, this group, about mail-in voting as an election procedure. And so that is something that I think is required to look at for June 2nd as well in case things aren't better from a public health perspective.
Early voting, the counties are going to proceed with early voting. And if you back up the date 28 days, and I don't want to give exact dates because the Indiana Election Division hasn't confirmed, but it looks like to me early voting would start around May the 5th. So I'm not going to give you an exact date because the Indiana Election Division, again, they set the calendar, and we need to notify clerks of all of those deadlines. And all of those deadlines I may not have mentioned will be moved back from the primary date.
So like the
Voter registration deadline would be moved. The requirement for the mailing of military and overseas ballots would be moved. All of those deadline dates would change with the date of the June 2nd primary. Campaign finance deadlines would change as well. All of those things are backed up from the date of the primary, so all of that would change. And what we will do is we will get that information as soon as the Indiana Election Commission meets and confirms those dates and changes. We will make sure that those are posted on our website so that you can all have that. And obviously, we're going to have to be working closely with the Clerks Association as well, so they will have those and know what they need to do. Sure.
Brandon, as anybody who's lived the last 5 days, anyone who would stand up here and make any guarantees about anything over the course of the next several months would not be a sane individual. So I'm not going to make any guarantees today.
I did not pay you to ask that question. Let the record reflect. Yes, we have gone from 56 to 79, and I have asked Dr. Chris Box to provide an update on the facts on the ground as they have changed beyond just the cases, but also some supplies and testing capabilities that are coming online and the effect that that's having on the actions that we're taking and will continue to take. Let me ask Commissioner Box to speak, and then I'll take every question you got.
Thank you, Governor. Good morning, everyone. So, as you know from our report at 10 a.m., we have 23 new cases for a total of 79 cases in the state of Indiana. New counties include Allen, Shelby, Vanderburgh, and Vigo. First time we're seeing some in the southern part of Indiana and the western part of the state. We did send just some trial tests over to Lilly yesterday and had 40 tests run by Lilly. They went extremely well. So we've done that times 5 today. They'll be doing 200 more just to make sure that they're up and running, and they'll continue to ramp that up so that hopefully we'll be doing several hundred by the end of the weekend with them. We're continuing to explore other options for testing in the state. There is one of our larger health institutions that is starting to test. We still have LabCorp that is here. Quest will hopefully get online in the Midwest here soon so that we can get some testing done that way. And then the CDC has released specifically for public health labs another way to test that doesn't use the same reagents, so we're hoping to get that up and running here in the near future. We did also have arrival of part of our state, our national strategic stockpile on Wednesday evening late. Thursday, we had Department of Homeland Security and ISDH along with the National Guard unpacking that because it came from 5 different places. So there were all the gowns and all the masks. And what we did was then break that down into what each county would need and repack that. So today we have INDOT and the Indiana State Police out delivering that. They'll be going to over 200 locations today, and those locations have been identified through EM Resource, those individual hospitals or local health departments that have said that they're in the red or the yellow zone. The rest of the SNS will be kept and delivered as the hospital systems and the local health departments need that. I also want to remind everyone that as we start to test more, we're going to get more positives, right? We expect that, so don't be surprised about that. And I want to say that we are continuing to see a lot of Hoosier hospitality around the state. We have appreciated the Guards' help so very much and that they have been here and helping us with planning. They have been helping with logistics. They are helping us make plans so that we could use medics from their department if we needed them. They have the ability to transport patients if we needed that. So all of that planning has been essential on-the-ground work that we have been doing with them, and we've appreciated their location here with us centrally and their help on that. As we look at Hoosier hospitality, I've had physicians and healthcare workers from all over the state that are now somewhat idled because they're anesthesiologists, they're not doing elective procedures, or they work in some other, maybe a plastic surgeon's office, and they're all offering help, which has been incredible. We have had anesthesia people say, we can run vents for you, we can give you our vents, we can donate it. So we are going to take them up on all of that if we need that here in the state. I would ask you to continue to be good Hoosiers and check in on your neighbors, make sure that they've got what they need, continue to protect our elderly individuals. I think with regards to the voting, if they can vote absentee, that's the best way to do it. But I really appreciate the messaging that you're getting out to everyone. And then I saw something kind of neat today in the press today. Arkansas had reached out to all of their contractors across the state that use N95 masks and other personal protective equipment and asked them that we would be willing to buy back your personal protective equipment or if you wanted to donate it. And they had a tremendous response. So I would say if there's anyone across the state of Indiana that feels that they would like to sell that back to us as a state, hopefully at a reasonable price, or donate that, we would sincerely appreciate that. So that's the end of my comments. I'm happy to take any questions that you might have. Right. So red is like we're in the next 24 hours potentially going to run out of what we need. So we were able to get that to them, which is good. Nobody ran out. There was nobody that called and said, I am totally out of masks, I'm totally out of gowns. There were people that were being creative and borrowing across hospital systems. We have large systems that are all over the state. There were local health departments that share. And if you look at the news, you're seeing this all across the United States. It's not just the state of Indiana that is being creative in this way. Oh, so yellow I think is 96 hours. They're down to 96 hours of what they consider their need. So we requested a very, very large amount, and we got a very small percentage of that, which is what every state is getting. The Strategic National Stockpile is actually allocated based on the population of your state. So they pretty much know what you're going to get, and that's how you get allocated. So we asked, and we got what we received, and we are continuing to push out. I mean, I've seen providers pull out of their bag. Dr. Sullivan today said, here's my N95. She's reusing that over and over and over again. So that's what we've messaged to our providers, and that's what they're doing, and they're being very, very careful about it. Yes? Well, we're asking them to reuse. We think that's the best way to do it, especially with the N95s. And again, the N95s need to be worn by those individuals that are most likely to be around people in an aerosol type presentation. So the person that has to intubate the patient, the person that has to actually do the testing is the one that's most at risk. But yeah, we are reusing. Actually, I've had several offers, and so we actually have some suggestions from our workforce development program here, which is a team that the governor started, and they've come back to us with what several other states are doing with regards to allowing retired physicians that have let their license drop to be able to be reinstituted. Obviously, I don't want my elderly physicians, of which I am one, so I don't want them on the front line taking care of patients, but I would love them to be doing telemedicine or backfilling in other places that we really do need the medical advice, but maybe they're not dealing directly with that COVID-19 patient. No, we've had no backlog, no.
Not at this time, and this gives me a good opportunity to say that this is why it's so important to follow the recommendations that we're putting out so we don't get to that day here in the state of Indiana. So the more people who practice social distancing, the less likely we get to the point to where we have to mandate a sheltering in place requirement. There are multiple, but we're not there yet in terms of community spread, et cetera.
Governor, are you considering allowing bars or businesses across the state to deliver alcohol?
We have not taken the delivery of alcohol. That's the first I've heard of it, but it's not on my priority list.
Madam Secretary, because we are pushing back on primary, looks like 30 days is a change. Any concern about the election infrastructure, dealing with mail-in ballots and those sorts of things that we'll have all the people we need in place, and folks since we'll have more time to go, we could have more participation.
Well, there wouldn't be a concern with more participation. I do know that some of the county clerks are a little bit concerned about if we did all mail, would they have the capacity to get those absentee ballots counted? There are different types of voting machines that we use in this state. Some require more intensive work when they count an absentee ballot. For an example, there is a type of absentee ballot that is a marked sense ballot. Well, you have to have the supplies, you have to have those cards, and you have to have the readers to read those cards. And so there is a concern with that. But obviously, the more absentee ballots we have, I would just say to you that we have to be patient on election night to get these results and get them counted properly. I can't answer that. We have talked with the county clerks. They are concerned about capacity if everybody voted. That's one reason why we agreed to leave the in-person option. If everybody voted by absentee, I'm sorry, I just heard what I said.
Yeah, it's, folks may be going stir crazy or dealing with some anxiety about being detached from their normal, plan of the day or their routine. That's understandable. I'm getting some very creative ideas from parents who are practicing social distancing. It is somewhat refreshing, quite frankly, to see so many people out, again, practicing social distancing, but walking the dog or, hoofing it around the block. As Dr. Box has said, playing board games or, maximizing this time to be closer with your loved ones and to, by the way, be closer with those folks in your building or on your block and checking in on your neighbor. And if you've got a room in your house like I do in mine, it's, gives you a little time to get organized and clear up some of the clutter. So my plea and my hope is that we all understand the gravity of what is surrounding us on a 24-hour, minute-by-minute basis, and that the more people who are practicing what we're preaching, the faster we will get through this as a state, as a city, as a nation. And Indiana has pulled together, quite frankly, during these last days, weeks, unlike very other few times in our state's history. And so I'm proud how strong Indiana is. We are pointed in the right direction. We need everyone to stay focused on the things that you think are little have a huge impact on where we will be 24, 36, 48, 96 hours from now. And so this 15-day period before us is critically important. And we have come a long way in less than a week. And I'm proud.
When I was mentioning what our workforce development group had come up with, those are some of the recommendations. So we'll be discussing those with the governor going forward. Yes, we have had people that have recovered. Since the numbers are small, I don't want to give specifics about that information, but we are starting, as I told you, to collect through the Indiana Health information and Regan Street those numbers, specifically discharges from the hospital, admissions to the hospital with the COVID-19 diagnosis. So we're going to have a better view of that probably, I would say, next week that you'll be able to see. Right. We still have several that are seriously ill, yes.
Is this the first time in history that Indiana's election was removed?
As far as I know. only the first, yeah, as far as I know.
Governor, could you address people who are homeowners?
Yeah, please don't. You know, don't become a hoarder. Don't become your own reality TV show. This is not the time. We're going to make the decisions that allow us to make sure the grocery store shelves are stocked. And I understand as we stand up in a, you know, go from 0 to 60 in a 24-hour period with such change before us that folks understandably wanted to get out and make sure they could take care of their own. But when I say Indiana strong, I'm talking about we're all in this thing together. And so don't take away from someone else. Buy responsibly, and we'll take every step necessary to make sure that you can go back to the grocery. This is an essential function. And we're focused on making sure that there is a clear division between what's essential and non-essential. And going to the groceries, obviously, in the former. Well, we are doing things to help to make sure that these deliveries can be made. And if they've driven around for hours, I need to know more specifically about that location, and I will step in.
We are giving every voter the option, whether or not they want to vote in person or by absentee. As I mentioned, it will be delayed results of the election. So remember to be patient, and remember that there will be some counties who have a harder time doing it. As I said, they may not have the supplies and the resources to do all absentee. At least not to get results on election night, for sure.
Thank you, everyone, once again for joining us. That concludes today's press conference, and we'll continue to provide information as it becomes available. Thank you.
Sorry, I left this in the
Dr. Box?
I'm fine. We have nice to meet you, Connie.